Good afternoon, everyone, and welcome to the session, Driving Innovation Through Public Procurement in Healthcare. In this session, we want to present how public procurement can drive innovation in healthcare. We will introduce key models and showcase opportunities for SMEs, startups, and healthcare providers provided by the InnoH support project. We will also present the communities like Healthcare Buyers Community or Agora, which create platforms for the stakeholders to collaborate across the innovation ecosystem. I'm joined here today with the three speakers and experts in health innovation procurement: Jorge González, director at Ticbiomed; Mojca Lesjak, who is the project and community manager at HealthProcEurope, and Natalia Norambuena, senior management consultant at Silo, the coordinator of the InnoH support project that is co-hosting this session. This will be a very informative session, but we also, invite you to ask questions. My colleague Laura from the Global Health Connector will collect those questions and bring them forward to the speakers. With this, I would like to pass the virtual microphone to Jorge González from Ticbiomed, who will introduce key models of the innovation procurement and tell us what the innovation procurement in healthcare is. Jorge?
Thank you very much, Karolina. I'm Jorge González. I'm the director of Ticbiomed. We are a business association. We are located in Spain, but we operate at a European level and especially through European projects. So now, okay. So what's innovation procurement? Innovation procurement is a demand-driven innovation approach. Okay, demand means that we start with the demand, whoever has the problem, in which a healthcare organization defines an unmet need, the problem we want to solve, and in collaboration with an external, usually a company, a startup, an SME, large company, co-creates a solution to find that, to solve that unmet need. Okay, let me show you with a graph. Maybe this is easier to explain. So as I said, we usually start with an unmet need that is identified, say, for a healthcare professional or for the management of the healthcare organization. And then when it's shaped, then we'd say, okay, before getting into the details of getting to solve it, what does the market know? What do the suppliers know about that, how we could solve that unmet need? And with that feedback from the market, then we define what we call a challenge, which is the combination of the initial unmet need with the knowledge provided by the market or from other entities within the organization. And then this challenge is published. Basically, the healthcare organization says, hey, who can help me to solve this challenge? And there is a call for suppliers. And usually this process is funded by an external funder of innovation, like, for example, the European Commission, but also national or regional agencies. And there is money involved where we say, okay, if you help me to solve this need, we will provide you with money, and we will together jointly find this need. So it's not that I give you the need, you go to your lab, create a solution, and then you hand it to me. No. It's an interactive process where the healthcare organization and the external company work together to find a solution. That is called co-creation, co-development, etc. But the important thing is that it's a joint effort. And then after the co-development, there is an evaluation. Sometimes the solution is not found, or the initial approach for the solution is not found. Okay. In our experience, the majority of the times there is a solution for that. And then the last, and usually this out of this funding scheme, they suppose that the healthcare organization that proposed the unmet need adopts the solution. And also there is a benefit because the company can also identify a business opportunity. Okay, there was a market gap, the unmet need, and now they know there is a solution that they can commercialize. Now, this approach is usually materialized in instruments. I would say these funding instruments. So for example, here in the screen, you can see the typical instruments that the European Commission uses for demand-driven innovation for pre-commercial procurement. In the left-hand side, you have usually unmet needs where the I don't want to get too technical, the TRL, the technological readiness level. That means that the solution is very kind of immature, okay? And through these different stages in a kind of funnel approach, you will work with different suppliers, and you will start with more suppliers, then less suppliers. In the phase 3, you have a deployment in order to see if the solution that has been proposed in the previous phases actually work, okay? But in principle, you are not supposed to procure for the solution in the same process. Though now the European Commission enables that. Okay, we can talk about that if there are questions. And what is on the right-hand side in blue is what is called public procurement for innovation. And there is that it is combined. You can buy a solution in the same process. Okay, that is for a much more mature type of solutions. So again, this is just one type, some type of instruments to do public procurement of innovation. We, for example, in Ticbiomed, we have explored other approaches which are leaner, faster than the other ones. For example, a PCP usually takes several years, 4 to 5 years, involves like several millions of euros, and it's relatively complex, not to say very complex. You have to publish the tender, you need to go through a lot of different stages with a lot of say bureaucracy, so to say. It is sometimes a challenge by itself following the process. While here in Innovator, it is more like a 9 to 12 months, 60,000 euros, and relatively easy or very easy. Now that's what we have tried. The key thing here is also that here on the left-hand side in blue is the process that I just mentioned, unmet need identification of the supplier, doing the co-creation. Here, perhaps something new is that we provide legal expertise, because what we really want is that after the innovation project has finished, it is then the public organization, the hospital, that launches a standard procurement process to acquire that innovation. So basically, on the left-hand side, you have proof that there is a solution. And then once you know that, the hospital is in a position to say, okay, I know there is a solution I want to acquire. It can be from the company that I have been working during the co-creation or another one. But the important thing is that the healthcare organization now can acquire a solution through a standard public procurement of an innovative solution. Now, why I told you before that sometimes these processes can be complex. Okay, why bother? Why this is important? And there are basically 3 benefits. Okay, and I'm going to go one after the other. The first benefit is obviously you solve an unmet need. You raise your hand, you say, I have this problem, and I work to be solved. It can be the solution can help you either to deliver better care for your patients or for your staff, your personnel. It can make their life easier, or be the system as a whole be more efficient. You can maybe save money, speed things up, deliver better care on a systemic level. Okay, so the very first benefit is to say, I had a need and now I can solve it, and I'm better because of that. That's the most obvious one. The second, perhaps not so obvious one, is to say, okay, one project is not going to change an organization. Okay, no matter how big or small a project is not going to change it. What do change an organization is the culture, the mindset that you are able to set up in the organization. Okay, so if you, by doing this kind of innovative project and acquisition of innovation, you create an atmosphere where you say, okay, my organization, me, for example, as a healthcare professional, enables me that if I find a problem, it helps me to solve it, and it helps me to have it on my day-to-day. You create a culture that over time, that's what changes an organization, okay? But you need to start. You need to start in doing that, and you need to enable the processes and so on and so forth. So public procurement of innovation is a way to do so, okay? It's an approach. There can be other ones, but it's an approach that you can leverage in order to create an entrepreneurship culture in your organization. The last one, and maybe it's a little bit far from you, but the thing is that if you help an external company to identify a new business opportunity, and that business opportunity turns out to be very successful, that local company will grow and will generate jobs, quality jobs, and they will generate, because they are growing, they will pay more taxes. And in most countries, healthcare is paid, public healthcare is paid through taxes. So they basically, you are helping them to help you in the later, at a later time. Okay. So again, it helps you to solve an unmet need, helps you to create an innovative mindset in your organization, and it helps you to get more taxes in the future. Now, before I said that this is the prototypical demand-driven innovation lifecycle, and as you can see here, there is a question mark under adoption. And what the thing is that what we see is that there is many times, as I said, there is a solution is successfully found, but then there is no adoption. And you say, why is that? I mean, it was the healthcare organization that asked for the solution in the first place. Why they are not acquiring it? I don't have too much time to go through that in this organization, in this telco, but basically, if you want to prevent that, you need to set up things before that happens. Okay, this is not the place for innovation, but just remember, if you set up a demand-driven process, make sure that there will be adoption at the end. Because if not, your entrepreneurs will be very frustrated that they will never want to do this again. And then you kill, instead of enhance, you kill the entrepreneurship culture in your organization. Very quickly, there are a lot of funding opportunities out there from the European Commission. This is one you will have access to my organization. There will be one regarding cancer. We have another program that is called InnoMatch. That is also, they have funding opportunities. And I'm not going to talk, but my colleague is going to talk about no support, and we are here also. We can provide support to help that incorporate in the organization, but you have to be in Europe. But we can help you with this. My colleague will talk about no support, and this is my presentation, Karolina.
Brilliant. Thank you so much, Jorge, for presenting what the innovation procurement is about, presenting some key frameworks and already touching on some opportunities for our healthcare community to engage, to get support, to get some grants for this work. And we will then move to Health Procurement Europe colleague, Mojca, Lesjak, who represent the Health Procurement Europe. Mojca, you work with those issues. This is your key scope of your work, and also you have established a community, healthcare buyers community, that works with this innovation procurement in healthcare. Please tell us a little bit more about your work and what are the opportunities for the organizations to engage and learn and be better in this innovation procurement.
Thank you, Karolina, for this presentation. Welcome, I'm Mojca Lesjak, Project and Community Manager at HealthProcEurope. And today I'll introduce you to the healthcare buyers community, our digital gateway for connecting stakeholders and driving innovation in healthcare procurement. The healthcare buyers community is a collaborative digital space for procurement professionals, hospitals, policymakers, pharma, and medtech innovators. Our goal is simple: to give everyone working in healthcare procurement one trusted place to learn, exchange insights, and access relevant opportunities across Europe and beyond. Why does this matter? Instead of fragmented networks and scattered information, healthcare buyers community brings everyone to one place. Here, members can connect with their peers, share experiences, exchange knowledge, discover collaboration opportunities, learn and grow together. Through our teamed communities, each with its own knowledge hub and curated content, users gain access to practical insights and innovative tools that support their daily procurement work. Members can co-create the platform by adding news events and resources, growing the knowledge hub for themselves and for others. Essentially, it's a community built for collaboration. It makes staying informed and discovering new opportunities easier, more structured, and more transparent. But healthcare buyers community is not just a platform. We also focus on building ecosystems that support collaboration in healthcare procurement. We bring together stakeholders from different countries, sectors, and organizations, and we make it easier for them to connect and work with one another. We remove barriers by making opportunities more transparent, accessible, and easy to engage with. We strengthen trust across the community by sharing success stories and practical examples of what really works. Through our teamed knowledge hubs, we curate content and match real needs with relevant solutions, helping members quickly find what they're looking for. In the end, the value we create is very concrete. Members gain new partners, new insights, and new opportunities that help them make better procurement decisions. And a great example of this approach is also the Innovate Support project. It has its own dedicated space within our community where we give the project greater visibility, share its news, events, and open calls, and connect its Agora network with a wider network of healthcare procurement professionals. Our members can join the Innovate Support Open community, engage with the project directly, and connect through the integrated chat that the community offers. This setup creates a direct link between innovation partners and procurement professionals. If you're interested in joining the Innovate Support Open community, you can do so from this QR code. If you'd like to explore further how healthcare buyers community can support your organization or your project, we'd be happy to connect. You can reach us through our email, website, or our social media platforms.
Thank you so much, Mojca. Can you just comment if joining this community is free of charge, or is it possible to be part of the community without being part of Health Procurement Europe?
Yeah, of course. Joining the community is free of charge for regular members. If you're interested in integrating an ecosystem, then this is another story.
Okay, thank you so much for presenting this opportunity. And you said you introduced shortly the InnoH support project, and I would like now to pass the microphone to Natalia, who works with the InnoH support project at the coordinator's office, as the PMO office. Global Health Connector is proud member of the consortium of the InnoH support, and we believe that providing the tools and the mechanisms to our community about the healthcare innovation procurement in healthcare can guide the innovations and better delivery of healthcare services. So we would be happy for everyone in the community to take advantage of those services that Natalia will present. Natalia, the floor is yours.
Okay, thank you very much, Karolina. Thank you for having me, and good afternoon, all of you. My name, as I said, is Natalia Norambuena. I'm Senior PNO Consultant at Science and Innovation Link Office, an innovation consultancy firm. Today, I will present the InnoH support project and walk you through these objectives and the key activities we are delivering to strengthen innovation procurement in the European healthcare ecosystem. I don't know. There it is. So we are a consortium funded by the Horizon Europe. We are 7 partners and 2 affiliated entities coming from 6 different European countries. Our joint purpose is to support innovation in healthcare through strategic use of public procurement, especially by helping procurers adopt innovation-oriented approaches and by connecting them with innovative suppliers across Europe. These are our objectives. First, to create a robust network of public and private actors that can work together to facilitate innovation procurement in healthcare. Second, to deliver capacity building programs and executive education that provides healthcare professionals with the skills and the knowledge needed to manage innovation procurement effectively. Third, to establish the Innovation Procurement Agora as a central hub for collaboration, knowledge exchange, and the best practice sharing across Europe. And fourth, to promote sustainable procurement strategies that are aligned with environmental goals and support greener, more resilient healthcare ecosystems. Our project is structured around 3 main pillars, as you might see here: capacity building, advisory services, and collaboration and matchmaking. These pillars translate into 3 different calls that we have here, 3 different services. For the capacity building pillar, we have the masterclass and the train the facilitator programs. The masterclass were open the 30th of May. This program consists on 2 on-site sessions and 4 online sessions delivered between September 2025 and February 2026. The masterclass provide a structured learning for healthcare professionals who need a clear understanding of innovation, procurement concepts, methods, and practical processes. Train the facilitator is also open from 30th of May, remains open until the next year. This program includes 2 on-site sessions and 2 online sessions within the same time frame, and is designed to prepare internal facilitators who will support their organizations in guiding teams, coordinating early engagement activities, and applying innovation procurement methodologies in practice. In the advisory services pillar, we operate a joint call, which remain open until March 2026. We have 2 tranches, one for the organizations with little or no experience in innovation procurement. We will support the procurers that are starting their journey and require structured guidance and foundational support. The second tranche is for organizations with experience in PPI or have an ongoing innovation procurement process, and it aims at a more advanced organization that need a specialized or deeper technical support. For example, for the tranche 1, we have 3 services that are strategic planning, needs and challenge identification, and open market consultation. For the second tranche, more expertise organization, we have funding opportunities identification, assistance in tender document preparation, and contract management support. All of these services will help healthcare organization address specific innovation procurement challenges. For the matchmaking, we have the first and the second cohort that are already closed, but the third cohort will be open the 7th of January until the 15th of March, 2026. Okay, so for the third cohort, as you might see here, we'll begin with a call for interest, and it's followed by a structured matchmaking session that brings together procurers, suppliers, investors, and ecosystem stakeholders. Across all the cohorts, all the sessions include solution pitches, challenges, and discussions, and one-to-one meetings designed to connect innovative suppliers with healthcare procurers. At the end, we have a matchmaking event that will be set in June 2026. And we would like to invite you to this matchmaking event where we'll be bringing together in an interactive format the selected suppliers with the procurement ecosystem. So if you want to participate or to present in the online matchmaking event, here you will have the link, I think, in the chat where you can register your interest. Also, I wanted to talk about the Agora. Agora is our digital hub for innovation procurement in healthcare. This is a free online platform fully integrated in our website, in Innovate Support website, that provides easy access to resource, events, and collaboration opportunities. The platform offers a dedicated space where healthcare providers looking for innovative solutions can engage directly with suppliers, investors, and procurement experts. Within Agora, users can also access the toolkit. This is a curated collection of innovation procurement resources, including methodology, training manuals, materials, best practices, and case studies. Agora has 4 main benefits. This is connecting innovation procurement stakeholders. You also will have practical knowledge by material, best practice, procurement methodologies, and so on. Also, the matchmaking, this includes linking buyers and suppliers through events, expert networks, and online showcase, and funding opportunities. You will have webinars, as you see here, the toolkit, and the community. We invite you to our Agora and our website. You can find here our mail if you have any question or doubt, our website and the Agora, And also our LinkedIn, if you want to know every news or every new cohort or new sessions. So thank you very much.
Thank you so much, Natalia, for going through all those opportunities. I think that many of them were shared with our audience through the chat. You can now apply and for all those opportunities. And I think, Natalia, all of them are free of charge. Is this correct?
Yes, correct.
Yeah, thank you so much. Thank you, Jorge. Thank you, Natalia. Thank you, Mojca. This is a big topic, obviously, and we try to squeeze a lot of introduction and also opportunities for the community of suppliers and procurers in those 25-30 minutes. I wonder, Laura, if there is my colleague Laura from the Global Health Connector, she was monitoring chat. If we have any questions to our speakers, is there anything specific about the opportunities they shared, or maybe something general about the innovation procurement?
Looking at the question now, so I have a question actually. How could we have better procurement best practice being shared internationally? So if you could answer to that briefly.
Thank you. Yeah, how we can share this more, like make this more visible, the good practices. Maybe each of you can respond in half an hour. I'm looking into Jorge. I think you look like you have a response to that.
Yeah, Natalia just mentioned the Agora in support. There are also other projects like Procure for Health that we have created some resources. From Ticbiomed, we also maintain an online library. I don't know what's the best way to share those resources, but my suggestion is that you contact InnoSupport, which is a hub that, for example, Silo and ourselves and HealthProcEurope, you contact us and we can share what is already available. Actually, there are a lot of resources, It's more about making those resources, put them in practice. Okay, so my suggestion is that leverage, if you are not familiar, contact us, we can help you, we can guide you to the resources, and the most important thing is that we can help you to make these things happen in your own organization.
Thank you. Mojca, how does it also work with the health buyers community? Best practices are they shared between the different procurers and suppliers?
Yeah, actually, all of the best practices that we input into the healthcare buyers community are shared under each teamed community. For example, once the Innovate Support project is finished, for example, its best practices are going to be integrated under the teamed community, where they will be shared with every member of the healthcare buyers community, even now and after the project is done, so that the work done during the project is not lost.
And Jorge, we have just 1 minute, and you touch also on the cultural change, right?
Yeah.
Where do you think like the organization can start with this process if they haven't, if they are completely new? What do they need? What would be your one advice?
Usually, what you will have is first the commitment, not only the interest, that the commitment that you want to make your organization innovative. And demand-driven is just a way to do so. But what the good thing about demand-driven public procurement innovation is that you will start with your organization. It is you who decides you want to focus on. It's not the typical vendor that want to push technology to you. And usually, if you want to start, you can have a strategy. It doesn't need to be very big because you will be learning by doing. And you can have just like a small initiatives like this, what I said before, this InnoBuyer, small projects or cheap projects, where you can get to know, understand. You can also then, if it works, that it will work, you can extend. But you are a learning organization that by doing and iterating and learning, to make it bigger and better over time.
Brilliant. Thank you, Jorge. Thank you, Mojca. Thank you, Natalia, for joining me for this short but informative session. And we invite you all to visit Innovate Support website for those opportunities. Thank you.
Thank you.
Thank you.
Thank you.